Hey everybody, in this NCLEX review series we'll be covering sickle cell disease. So sickle cell disease is an autosomal recessive disorder. It's genetic, meaning that in order to develop this disease, both parents must be carriers of the disease. You can see on the right I have the little chart there. So O means other gene, little r means the recessive gene for sickle cell disease, and then the colors correlate. So the probability of a child to not get the sickle cell gene at all is 1 in 4, or 25%, as you can see in the top left with the teal, blue, green color. In the blue color, we have the probability of a child being a carrier is 2 in 4, or 50%. If a child is a carrier of the disease, they can still show symptoms of sickle cell disease, although they are much milder symptoms. And then in the bottom right, the probability of a child getting the disease is 1 in 4, or 25%. And remember to note, both parents have to be carriers of the disease in order for a child to have sickle cell. Alrighty, so the pathophysiology here, we will be looking at this. These are your strands of DNA, just a very small portion of it. So you can see a normal hemoglobin. In people with normal hemoglobins, their DNA chain reads guanine, adenine, and guanine. In patients who have abnormal hemoglobin, called hemoglobin S, their DNA chain reads guanine, valine, and guanine. So hemoglobin S is the type of hemoglobin cell that is found in sickle cell disease. So this is more down to the cellular component of the genetic portion of this disease, this autosomal recessive disease. Looking at the hemoglobin cell in sickle cell disease, this hemoglobin S, you can kind of remember S as in like sickle. It looks like crescent shape, almost like a half moon. These are the cells that are found in sickle cell disease. They are typically more stiff and rigid and not able to carry as much oxygen because they're like half the size. So for diagnostic tools, sickle cell disease is screened for at birth. Some other tests they can run to determine sickle cell disease is a peripheral blood smear, and it looks for abnormal red blood cells. You can also do a Sickling test to screen for hemoglobin S, and you can also do a hemoglobin electrophoresis to determine the amount of hemoglobin S. And I put a picture here on the right that just shows this hemoglobin electrophoresis and how those hemoglobin S and those sickle cells show up on the chart. Signs and symptoms of sickle cell disease. Anemia is a common sign. Women, their hemoglobin is typically 12 to 16. Men, typically 13.5 to 17.5. These ranges change, depending on the hospital you work at, the textbook you read, what website you look up. But in general, right around these numbers are normal levels. Patients will also have pain that is diffuse throughout the body, and this is from the sickle cells, those crescent-shaped hard, elongated cells occluding vessels. When sickle cells occlude vessels, they get pain like in their back, in their chest, extremity pain, abdominal pain are the most common sites. You will also see hypoxia, such as oxygen levels less than 90% and cyanosis, if it's a late sign or more profound hypoxia. And then some of these other signs here, so fever, like tenderness and swelling in the joints, hypertension, tachypnea or rapid breathing from the pain in the chest, or hypoxia, and then nausea and vomiting. This is what hemoglobin in the bloodstream will look like in a patient who has sickle cell disease. So you can see on the left they have hemoglobin cells that are round. These are flexible, permeable, and the hemoglobin S on the right, you can see the crescent-shaped hemoglobins, and those are stiff, rigid, hard, and have less of an ability to carry oxygen. One of the big things you see in patients with sickle cell disease is what's called sickling episodes. This occurs when red blood cells become sickled or elongated and rigid. So in a patient with sickle cell disease, they may have some of those circular ones, but then as soon as they're exposed to these triggers, those circular hemoglobins will turn into those crescent-shaped, rigid, elongated cells. And this is where you can get some problems, which we'll talk about later. Some of the triggers for a sickling episode is hypoxia, viral or bacteria infection. Infection in general is the most common cause. High altitude, also relating to that hypoxia. Emotional or physical stress, surgery, and then blood loss as well. Vaso-occlusive crisis is a complication that can occur if the sickled cells cause a stop in blood flow to organs. So basically what happens is blood flow is impaired due to sickle cells. So the blood flow cannot get to vital organs. So that leads to tissue hypoxia and can also lead to vasospasms. With tissue hypoxia, it can cause a stroke. So the occlusion in the blood to a certain area mimics an ischemic stroke. A pulmonary embolism, occlusion of blood flow to the lung, causing a pulmonary embolism. Shock, acute kidney injury, chronic leg ulcers, and pain. And then with vasospasms, a vasospasm is when the artery clamps down. They spasm, and this can also cause an ischemic stroke and also a lot of pain. Treatment for a vaso-occlusive crisis is oxygen. You want to give a lot of fluids, treat their pain, and then education about avoiding triggers to prevent these vaso-occlusive crises. A little bit about how the spleen functions in sickle cell disease. So the spleen hemolyzes the sickle cells. Over time, typically like 2 to 4 years, the spleen becomes scarred and dysfunctional, and it also atrophies. It becomes smaller. So because of this, it's unable to recognize foreign substances, which can lead to an increase in infection risk. And remember, what was the most common cause of sickling cells in sickle cell disease is infection, right? So patients become even more prone to sickling crises or vaso-occlusive crises when their spleen is unable to recognize infections. One medication that can be prescribed in sickle cell disease is hydroxyurea. Hydroxyurea alters the adhesion of sickle cells to the endothelium, so this decreases the frequency of sickle cell episodes. There are some adverse side effects, however, including interstitial lung disease, secondary malignancy, and leukopenia, or low white blood cell count. Some important teaching points for patients with sickle cell disease is to avoid high altitudes, drink fluids and stay hydrated, treat infections right away, and also family planning counseling so patients are aware of how this is a genetic disease and can be passed on to their offspring. Thank you guys so much for watching. You can check out a video I made on a case study for sickle cell disease for the Next Generation NCLEX if you're studying.